Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everyone. It's so great to be here with you all. And I do have another one of my graduates here joining me today from the Functional Nurse Academy. Joining me today is Michele Kostedt, who is a registered nurse, and she is also a board-certified holistic wellness nurse coach. She is the founder of Holistic Wellness and Coaching, and Michele is a health coach who helps women over the age of 40 to thrive in perimenopause and beyond. After 25 plus years in conventional nursing, Michele stepped away from a system she felt was managing symptoms rather than asking what was driving them, and became interested in functional wellness, where the question is always, what does the body need? Her work is grounded in the conviction that the body was intelligently designed by God, with remarkable wisdom and capacity to heal when it's given the right support. She coaches women virtually in all 50 states through her signature course called Designed to Thrive and her wellness membership. Welcome, Michele.
Thank you so much for having me.
Yes, it's always so good. I just love connecting with you guys. And so to our audience, Michele sent me an email the other day to let me know about this course that she launched. And I was just thinking, yay, because, as nurses, when we open up our own businesses, there's so much opportunity to reach so many more people and make an impact. And then on the business side of it, there's really so much opportunity in nurse entrepreneurship. So I'm so excited about what you're doing and reading your bio. So 25 plus years of conventional nursing. God bless you. I would love to hear about your story. What exactly was it through all those years of nursing that caused you to make the shift?
Well, I always wanted to be a nurse from the time I was a little girl. I've always loved science. It was just my childhood dream. And so straight out of high school, I went into a college nursing program and I became a nurse right away. I was really specializing in oncology. I was giving chemotherapy for several years, and I loved that. I think what I liked most about it was in that setting, you could really have a one-on-one interaction with the patients. You would see them again and again. So really form a lot of relationship. I could do a lot of education. So I really thrived in that environment. After a few years, my husband unexpectedly died, so I didn't feel like I could be in that type of role anymore. I had to take a few years off, and then I moved into working at a clinic where we were doing colonoscopy. So it was a pretty radical shift, but I still really enjoyed doing the colonoscopy work. I was on that, and I was doing more of cancer prevention at that time, and I was very much ingrained in the world of conventional medicine. I believed in it. I was raising my son, giving him all the vaccines, all the antibiotics. I mean, everything that I thought I was supposed to. But, there was just some flags along the way that kind of started to open my eyes. I mean, even something as simple as learning about essential oils, early on, I thought, gosh, this really works better than I thought it would. And I mean, everyone would always joke, oh, Michele has an oil for that. And so I was using it for everything. And then my son, as a teenager, he had a reaction to a vaccine at some point. And I mean, he just missed all kinds of days of schools and nobody could figure out what was going on with him. And so that got me thinking a little bit too about making me questioning a little bit about the healthcare system. And then when COVID started, my world kind of really opened up because then I began to really start questioning a lot of the rules and, just some of the mandates that were happening. And at that time in my job, I was doing a lot of chart review. So I was reading like report after report after report of patients that were gone to the primary doctor. And I began to see the same thing over and over again. They would go to their doctor with a symptom. It was a quick visit, and then they would leave with, either a new prescription or a new referral or just a new diagnosis. But there was really no education about the root cause or how to get off of medication or, any lifestyle modifications. If anything, there was just a little blurb at the end of the report, to do 150 minutes of exercise every week, but it was very standard. And so I began to think there's got to be something more. And so I first started with a nurse coaching program, and I liked that, but it was more of life coaching, and I felt like I still liked the science of it. I still liked the root cause. I still wanted to, do some more of that investigative work. And then I found your course, and that really opened my eyes. That really just changed everything for me, because I didn't even know it was possible as a nurse to have a business as a health practitioner, and the ability to order labs and do the education, which is something that I'd always loved throughout my career, was the patient education. So that's kind of my story in a nutshell.
Well, and I am so sorry about the loss of your husband.
Oh, thank you.
So, and again, as nurses, and that's something else I've loved about nursing, because I actually was an elementary education major, but then after substitute teaching in schools and having so many teachers get in my ear and they were like, don't do this, Melissa, I decided to change it for nursing because I loved education so much. And I figured I could go through nursing school and I could still go into education. And again, like we really do have so much opportunity as nurses. And I joke about, with what I know now, if I did go back into the system, I'm sure I would get fired, because because there's so many things that are being used that are outdated. And I also agree with you on the vaccinations. I think that we've gotten very reckless in this area. And, so many healthcare professionals just believe in it like it's a religion, and there's nothing that you can do or show them. And but yeah, I see a lot of nurses really coming around on that. And I also noticed this when I had interest in starting my own business as well as a nurse. Like, I felt like so many of the programs out there, may have been very nice programs, but it just wasn't going deep enough. And I felt like as a nurse, we already we're basically natural health coaches, because we have so many hours working with the patient population already. So, well, I really like that. You mentioned that you are working with women in midlife, and again, like I think Williams Health. Okay, women's health. And guys, to our listeners, so the baby finally started sleeping again, okay? And I felt like my brain was back online, but then he started teething, so I'm back to not sleeping. So if I say the wrong words, it's the baby's fault. So anyway, I really like that you are specializing in women's hormones, especially midlife women, because we all know they are like not getting the help that they need. And I would love to hear from you, just kind of like the contrast that like you're doing. Like, when you start working with women that are midlife, what kind of things is the conventional system offering them? And then in contrast, how are you helping them?
So, I think in the conventional system, it's really just there's a couple of things. One is that the conventional system is really just aimed at quieting the symptoms, like quieting the hot flashes, or, giving a prescription for every symptom. So if someone's having brain fog, then, they'll give a prescription for that. If they're having mood changes, they'll give an antidepressant. If they're having trouble sleeping, they'll give a sleep aid. If their cholesterol is rising, they'll give them a statin or something like that. So that is the way that the symptoms in midlife are handled. But or the other issue is that maybe they're just completely dismissed and just said, well, it's just part of aging. This is just something that we expect. We expect the weight gain. This is just something that you're going to have to deal with. And then oftentimes either they're given all those different handfuls of medications to treat the symptoms. They may be given hormones, but oftentimes it's still just the lowest dose possible for the shortest period of time. And many times it's still synthetic hormones, or maybe they're just given birth control. And I've heard your how you feel about birth control too. And we're on the same page with that, because it's really, it is not the answer to the symptoms. And so where I come from is that what I believe is that in midlife, our all of our hormones, like the estrogen, progesterone, testosterone, they're not just sex hormones. We have estrogen receptors all throughout our body, so they're whole body hormones. And so all of these symptoms that we're seeing of the weight gain and the blood pressure rising and the difficulty sleeping and the other symptoms like frozen shoulder, all of that is related to the decline in hormones, the estrogen. And so I come at it with a couple tiered approach. Is one, I do want to give hormones at a physiologic level, meaning at the same level that we had in our menstruating years, our cycling years, because the hormones are so protective and so supportive, and also giving it in a way that matches the rhythm of our bodies. So our body always ran on a rhythm. It was never just a static line. In the beginning of our month, the estrogen would gradually rise and it would have a peak, and that would send out some really important signaling instructions, and then it would start to decline. And then progesterone is really only in the last half. So I really advocate for giving hormones to mimic the body's cycle with that same rise and fall, and only the progesterone in the last half. So that's part one. But before we can even get to hormones, is we really have to address the foundations. And that's really what I specialize in as a nurse. I do the comprehensive lab testing with both blood and Dutch tests, like for the urine hormone test, and look at the cortisol levels, but also gut tests, like for like a stool test to see what's happening in the body, how the body's absorbing nutrients, whether there's a good balance of the microbiome, how the body's detoxifying estrogen. So we look at all of that and really start with those foundational principles of addressing sleep patterns, doing the resistance training, making sure you get enough protein in your diet, making sure that you're getting outside to get sunlight, making sure that you're moving throughout the day, all of those, because you can't just give hormones to a body that's not supported. We have to start with that foundational level first. And there's a lot of work to be done there. And then we can start to layer in hormones. And that's a very different approach than the medical system takes, because they don't really address any of the lifestyle issues. They just try to quiet the symptoms.
And I love that you're just talking about common sense, like get out in the sunshine, lifestyle interventions, nutrition, things like that. And I want to circle back to the SSRIs and the antidepressants, because again, just like how I feel like the medical system has gotten very reckless and they're like, oh, yes, let's give 72 doses of, vaccinations. And we've, kind of never studied all of this at once to children from birth to ages 18. Let's just give them a lot of vaccinations and let's just see what happens, right? We're seeing that with SSRIs too, because a lot of women that are having these hormonal changes start having issues with like sleep, anxiety, depression, mood swings. And I feel like the antidepressants are just being handed out like a Pez dispenser. And it's something that really gets my goat, guys. I just want to go over a couple of studies on that real quick. So a while back, there was something called the STAR-D trial. And this showed that like, wow, you know what? SSRIs, they're just God's gift to people with depression because it just fixes everything. Well, that trial has been reanalyzed, and they actually found out that, and I know this is shocking to you guys to hear about, the drug companies lying. But anyway, the drug company who is funding their own trial, they actually included individuals in that trial that never had depression. So when the trial concluded, they were like, oh, look at all these people that don't have depression. But so many of those people didn't have depression to begin with. So when you actually reanalyze that, the actual remission rates were actually approximately half of what was originally reported. And that number is similar to placebo. We know the placebo effect is about 30%. And then there was another trial that trialed multiple antidepressants, SSRIs, SNRIs, analyzed over 500 trials, and they saw that the antidepressants were roughly 10 to 20% more effective than the placebo. And then we have all of this evidence that when we do things like an anti-inflammatory diet, we actually give people the nutrients that they need, that so many individuals start to get better. So, anyway, I just had to go on my little spill about that because we know that antidepressants, literally, like the symptom of suicidal ideation is on that insert. And I think that these providers need to be responsible about what they're prescribing. So anyway,
Well, and I'll just add too. I mean, I just talked to somebody the other day, and she was prescribed an antidepressant, Effexor, just for her hot flashes. So she wasn't even having any depressive symptoms, but that was the answer for her hot flashes.
of course it was. Yeah. And I know, like, I need to, I don't want to be like overly skeptical on this show, or I don't want to get like sassy, but I also think that when there's like ridiculousness going out in the medical field, I also think that like I shouldn't just be sugarcoating it and I should just tell it how it is. But so from you, just knowing to do these common sense measures and being able to do some more advanced testing on them, figuring out, what could be some obstacles. Do you have a success story that you would like to share of a client that you were working with?
Yeah, I was working with one client in particular, and she was actually pretty healthy overall. She had a healthy lifestyle. She was already implementing a lot of the lifestyle interventions that I would recommend, but she was concerned about her cardiovascular health. She was concerned about her risk for dementia because her mom had Alzheimer's. And so I did some comprehensive blood testing, and I also did a stool testing on her. And I gave her a protocol recommendation of some things to do, mostly with supplements at this point. And I checked back in with her a couple months later, and she had said that like her bowel habits had become more regular, which, as we know, is very important. And there's definitely um, that gut brain axis. So when we can improve our gut health, that can help with our brain health as well. But something that was so surprising is that her back pain went away. She'd had back pain for over 30 years, and she had tried everything, in her words, and now it was gone. So she was able to do her exercising without any pain. And I think it all comes down to when we can support the body foundationally, when we can, give the body those anti-inflammatory foods. In her case, we were adding in a lot of different fish oils and, some other anti-inflammatories, but just supporting the gut and just doing a lot of that foundational work. And it really makes a difference for the whole entire body.
I've seen similar stories like that, and this is something that can be very saddening for people, especially when someone is active and then all of a sudden they are struggling and dealing with chronic pain every day. And as functional nurses, we know what that does to your cortisol too. Chronic pain is going to have like a physiological impact on you that's really negative. But there are people who, like, I worked with one man who his knees were just hurting him so much, and he loved to play basketball, and he couldn't go and play basketball with his teenage son anymore. And it was a matter of 6 to 8 weeks, and he was out playing basketball again, and it's like the system that they don't really know what to do beyond pain meds and anti-inflammatories. But since you're doing so much testing and teaching about these foundations, do you see like do you see certain commonalities in regards to, and I will say the way I look at it is kind of helping to identify potential obstacles to healing. So, do you see something that is commonly an obstacle for people, nutrient deficiencies, gut issues? Like what do you see the most of?
Well, probably all the above, but I mean, certainly I usually start with the metabolic health first because that seems to be so widespread. And, just looking at more than just the A1C, which is what you normally get when you go to your doctor for the physical, if you get that. But looking at the insulin level and trying to detect when they may where they're already at risk for prediabetes or diabetes, we can catch that so early on. So really addressing the metabolic health, sometimes we can add in supplements, but sometimes it's just a matter of moving, like after you eat to, move for 10 to 15 minutes, and also to build muscles because our muscles are basically a glucose sink. They gobble up all that extra glucose that's circling. And so, I think for most people, and especially for women in midlife, the metabolic health is one of the very primary tiers that I work with first, and that affects when our metabolic health is out of balance, and that affects our inflammation, our sleep, and it just is a compounding effect.
Yeah, and I saw some recent statistics coming out of the CDC saying that approximately 7% of Americans in the US are metabolically healthy. And then I thought about, because when we do labs and I teach you guys about the optimal ranges versus the standard reference ranges, and the fasting insulin, the normal range is like 0 to 24. And
Exactly.
and then you have to think it's like, okay, if those reference ranges are based on the average American and people are so metabolically unhealthy, but I think it's another good teaching point about things like exercise, because we know that individuals are so much more compliant with these interventions when they understand why it's important. Because something like building your muscle mass, I mean, muscle mass is really important to your hormone production. And like you said, it's really important for your metabolism too. And what kind of things do you like to use? Because I know so many people are just struggling with inflammation. What have you been using in your business that you think is really impactful for getting inflammation down?
Uh, well, I mean, I mean, it really just kind of depends on the scenario, but I think gut health has a big part of that too. So, uh, I think we would do some stool testing, but, our diet plays a big role in that. So, y- I don't like to be too restrictive on a diet, but doing an anti-inflammatory diet for a period of time. Um, and then, like I had said before, just even adding in fish oil, getting that balance of your omega 3s is really important.
Yeah, yeah. And when I was doing some research on neuroinflammation. And there's so much evidence that when someone has a lot of overgrowth, like dysbiotic overgrowth in the gut microbiome, that can produce inflammatory cytokines that not only can get into, circulation and cause all kinds of other issues, they can also cross the blood-brain barrier and cause mental health type issues. And the gut, I mean, it is so foundational, and we have some solid research about the importance of the health of the gut microbiome. And I think as nurses, we're so suitable to work in this area because I mean, the entire time of our nursing profession, how many times are we asking people how often they poop or what their poop looks like? So um I also wanted to ask, okay, so you had mentioned before just kind of like rethinking hormones. And what if we replaced them the way the body actually made them? I would love for you to elaborate on that a little bit more.
So I kind of alluded to earlier of how our body runs in a rhythm. We, as women, we're on this 28-day cycle. And so our estrogen rises at the first half of the month. It peaks. And that provides some really important signaling instructions to our body. And then it starts to taper down. And then that's when the progesterone starts to be the star player. The last half of the cycle, the progesterone starts to rise. And then it has a peak and then it starts to decline. And that's not by accident. That's exactly how God made our bodies, to have that rise and fall, those peaks. So, in fact, even when our estrogen rises, it's preparing the body to receive the progesterone. So many times when women are given just a static dose of the hormones, they for instance, if they're giving progesterone the same dose every day of the month, then they may feel good for a while, but then it stops working. And it's not that their levels are bad. Their levels, if you test them, they may still be within the therapeutic range, but their receptors, they get kind of sluggish or lazy, like they're not accepting as many of the hormones. It's like this lock and key mechanism. And so then it doesn't seem to work as well. So when we can cycle the hormones the way that the body has done for decades, like 30 plus years when we were cycling, then we can achieve some of the same benefits that can help with our brain health, our bone health, our cardiovascular health. And that's what I'm trying to do with the hormones when we're replacing them in a rhythmic physiologic level, or replacing them physiologic levels and in a rhythmic manner, because that is very different than the conventional medicine where we just give it at a static dose, the same dose each and every day, and typically at a very low dose. And that's largely because of the WHI study that was very poorly done. They were using synthetic hormones. They were given the hormones orally, which that in itself puts women at a lot of risk. And then they were giving just the same dose every day. So that created a lot of fear. And that's still what practitioners are practicing off of today, even though the study has been debunked and they've taken the black box warning off of the estrogen boxes. That's still how practitioners were taught to practice.
Yeah, yeah. And I think too, the some green flags of a good provider is humility, because this is really a barrier with some providers because they spend so much time in training, especially the ones that go through medical school. I mean, that's such an investment. It's so much time. And some of them have a hard time coming to the understanding that they may have learned something in medical school that was incorrect. And I will say, when I think back to my training in nursing school, there were a lot of things that I was taught about in school that have been completely debunked or were things that were influenced by industry. And it's very frustrating, when you make that type of like time commitment and investment. And I always think too, I do think that HRT, hormone replacement therapy, can absolutely be a really wonderful tool that can help women and men get their lives back. But I do think that there is a problem sometimes with providers jumping to HRT too quickly and not understanding that there may be some underlying issues to what is hindering your healthy production of hormones, or there may be some like natural interventions that could help to support your body to produce hormones. I see that step is skipped frequently. And then a lot of providers don't know how to properly prescribe hormones. And then also, it really makes me think, like, what is going on with so many women that when they're going through that shift, their bodies can't handle it. And we know, for an example, minerals are precursors for your hormone production. We also know that you need sufficient cholesterol for your hormone production. How many women are unnecessarily taking statins? So, before you say that you have a woman who is having clear signs that there's something going on with the hormones, but they're really not there yet, or maybe they're in that stage where their bodies can be supported to see if they can have improvement on their own. Like, have you seen anything that is has been particularly successful in those situations?
Yeah, so I mean, I definitely think you're absolutely right that we have to address the foundations. We really cannot layer on hormones in a body that's not well, that is metabolically unhealthy when a woman isn't eating the right building blocks. Like you said, if she's not getting enough protein in, if she's not doing the exercise, the hormones, they may help some, but they're really not going to achieve the full benefit. So, absolutely, we need to do these lifestyle interventions, especially the stress management. So doing things like getting outside in the early morning to help with that circadian rhythm, because that's another rhythm in our body that we need to support. So getting outside in the morning to get the sunlight in our eyes, and even that starts the countdown in our body for our body to produce melatonin, which is going to help with our sleep, which so often women in midlife are struggling with sleep. And then adding in all these other foundations of, um, you know, trying to get more sleep with, maybe limiting blue light for a few hours before bed, or maybe not having such a heavy meal before bed, or, doing some kind of journaling practice or something to do like a calm down routine. So all of that is really important. I think that I've seen some benefit in some of my clients that have improved some of their symptoms from their hot flashes just by improving their mineral balance. So I've done some HTMA testing on my clients. It's like a hair tissue mineral analysis, and where it shows some of the mineral imbalances and deficiencies. And when we can support the body that way, then there's been some radical improvement. But I still think that even in that, we're helping with the symptoms, but we're not going to achieve some of the overall goals of the longevity of the protection for the brain health, the heart, the bones, that we would achieve with hormones. But I think it's also important to add in that it's really important to ask a woman what her goals are, and that's something that you don't often get asked when you go to your doctor. You usually have a chance to say, this is the problem I'm dealing with, and you're given a prescription. But with hormones, it's really a discussion that you need to ask. What are your goals? Are you simply just trying to, cut out the hot flashes? Are you just trying to sleep a little bit better? Or are you after the longevity where you want to protect your brain and your heart and your bones, so that you can, be still, getting off the floor easily, and picking up your grandkids, in 20, 30 years from now. So that's really a conversation to be had with each client. It's very individualized.
And I think some of the worst advice that we get from conventional healthcare is avoiding sunshine and slathering on sunscreen when we know, I think it's almost 30% of sunscreens on the market are contaminated with benzene, which is a level 1 carcinogen. And we actually have large studies out showing that individuals who are using sunscreen frequently actually have higher skin cancer rates. So, but something just as, I mean, don't go out and get sunburned, but I mean, getting that healthy sun exposure, that's something that, like, when I look at my wellness routine, that is like, that is like part of my routine. Like, it's a non-negotiable to get out in the sun when it's a nice day. But a lot of these interventions, they can really go a long way. And I really like that you mentioned the stress response, because I feel like even women that are like, oh, no, I'm not stressed, after I finish working, like talking to them through the session, I'm like, yeah, I think that there's some things we need to work on your, nervous system regulation, but getting that under control because so much of the hormone signaling is coming from the brain. And when you have someone who is in a super upregulated fight or flight response system, we know we're going to see some, HPA imbalances there. But we are about halfway through the show, so we're going to cut to break real quick. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. Today, I am joined by one of my amazing Functional Nurse Academy graduates, Michele Kostedt, who is the founder of Holistic Wellness and Coaching. And she specializes in helping women over the age of 40 thrive in perimenopause and beyond. Welcome back, Michele.
Thank you.
So I know the first half of the show, we had covered there's just so many things that we can do to help these women that are struggling with hormonal issues. And then you were also talking about how we can advocate for them to be able to, if they need HRT, to be able to get that prescribed in a way that is appropriate for their needs. And something else that you offer, which I think is really interesting, is you mentioned that you are also offering frequency and sound therapy. And I know that you said that as a conventional nurse, you used to kind of dismiss these things, which is exactly how I was too. So can you tell me, what exactly is frequency and sound therapy, and how are you using that to help the clients you work with?
Yeah, so I have a couple of different ways. One, I use frequency specific microcurrent, which is using very low dose electricity. You put some electrodes on the patient or the client. You use some like wet towels as the conduits, and then there's different protocols that you can use to help the client. For all different kinds of protocols that you can do. And you mentioned inflammation before. That's one of the ways that I can treat inflammation. But I just had remarkable success with treating shingles or helping with the stress response. So that's one of the things I offer. And then the other is something called the AO scan. So I do all kinds of sound therapy and just using frequencies to really help support the body in a lot of different ways.
So I'm very interested in the frequency specific. What was that called again?
Frequency-specific microcurrent. And, I wanted to tell you that the whole reason I went down that, or found out about frequency-specific microcurrent, it's called FSM, is because of you, actually. So you had recommended the book Toxic by Neil Nathan when I was in the FNA Academy. And I was just reading that book, and there was just this little blurb in there about FSM. And I think it was talking about using FSM for insulin resistance, which is something that I had struggled with. And so it just caught my attention. So I was looking for a provider that offered it, a provider near me. And I went to go see her, but I didn't sign up for a treatment. I just had questions because I was very skeptical. I didn't know. The whole idea of frequency sounded very woo-woo to me. I thought I brought my husband because as a Christian too, I was like, I didn't really think that the idea of frequency was something I even wanted to touch very much, but I was intrigued and I wanted to learn about it. And that provider, she was so patient with me, and she really just kind of taught me that our bodies are energetic beings, and our cells, they run on the sodium potassium pump. We have electrons and protons in our body, so we are energetic beings, and we know that we in the conventional medical system, we do the eat, EEGs to look at the brain health, and the EKGs and the MRIs and the ultrasounds. And, and for the field of depression, they use the TMS with the magnetic stimulus. And, all of that is using frequency. And when she put it into perspective like that, it, it really kind of shifted my perspective, because I thought, oh, this isn't quite so woo-woo after all. And so when I started to use the FSM, I actually did book an appointment with her, and I just saw some amazing results with the FSM for myself with my insulin resistance. And she encouraged me to become certified and to become a provider, so I did. And I started using that in my own business. But then a friend of mine, she had introduced me to the AO scan, for the like the sound therapy, and that that seemed a little bit more woo woo, because that wasn't anything that was actually touching the body. This was being done something remotely and everything. But with her, she had originally contacted me um, maybe 9 months before that, and she had actually reached out to me to ask me to be her functional medicine provider. But she was so sick. At the time, she was in a rehab hospital. She could barely even sit up. Otherwise, she would want to pass out. She couldn't even hold a cup, because she had TIA. She had the long COVID, and she was diagnosed with, similar to POTS, but like an autonomic dysautonomia. And when I saw her, I thought, I can't help you. Like, you are much more too complex for me. I said, I'll pray with you, but that's about all I can do for you. And so I sat with her and talked with her and prayed, but I did not. I said, you need to see, some specialists. And so she did. She went to all these different specialists, and nobody could really help her. And I mean, she got a little bit better, but not significantly. And it wasn't until she used the sound therapy, this AO scan, and using these frequencies, that it really helped her. And so when she contacted me later, and she was so much better, and she told me about that, that really made me believe that there was definitely something to this.
Yes, yes. And there is so much talk about frequency medicine. I am very interested in it as well. Now, I personally, something that because again, I've been healed from Lyme disease. I feel pretty good, but I do some just things for maintenance. And something that I really, really like and support is photobiomodulation, which is like red light therapy. And I
Yes.
actually have a friend who is a practitioner and has like a very high powered device. It's essentially cold laser therapy, but we're seeing that modality really helps to support the mitochondria. And anyway, I have heard with frequency medicine and with sound therapy and things like that, that there's a similar function, how it just has a supportive impact on the body. And I do think that God God has created frequencies, guys. And something that I have seen, again, being in the Christian community, is there is like a growing, kind of like a growing movement of Christians that are just calling everything demonic. So, like, I even heard of a ministry that has like a pretty large following that was, saying that vaccines are science and is all about the pharmaceutical industry, but then says that functional medicine is quackery and that frequency medicine is pseudoscientific and new age, and that like the body field isn't real, which again, these are very easy things to look up and see that like these are incorrect statements. But there are a lot of Christians that hear things like that, and then they're scared to death that they're going to choose the wrong modality and be damned to hell. So I also wanted to talk about this from a Christian perspective. So, what is it like about like the frequency therapy and the sound therapy that you think some of these individuals who I think themselves are deceived and think that we just need to be dealing with our chronic illnesses and just taking your, meds from the same company that produces chemical abortion pills. But anyway, so from your perspective, like, And again, I can't even wrap my head around it that like you're like, oh, pharmaceuticals good, frequency medicine and functional medicine bad. But like, what is it about like the frequency and the sound that just turned so many Christians away, or that they're just so skeptical of it?
Yeah, I think it really comes down to fear and lack of knowledge. I think there's because the New Age, religion, or those that are really into New Age, they've known a lot of these things for a long time. The idea of, the body has chakras and meridians, and using different crystals, and that, crystals are basically just rocks with frequency. And so they can be used for good or bad. And so, the what I would tell another Christian that has fear about it, like maybe fear about crystals, is that God created those rocks. God created those rocks with a frequency, and I'm confident that God knew what he was doing when he created that. It didn't come to us as a surprise to him that, these rocks, had, healing powers or healing frequencies associated with them. So, I think it's the fact that as, um, when we can use the frequencies that God created for good or bad. There's so many frequencies in creation. I mean, that's why I think it's become more commonplace to accept the idea of grounding, of going outside and getting your feet in the soil, like in the grass, or you oftentimes you feel so much better. I live in California, so going to the beach and getting your feet in the sand or the ocean water, there's something very healing about that. Or even the sunlight. The sunlight has its own frequencies. I mean, that too is something that can be so therapeutic. So I would just say, to really, before you make a rash judgment, just to give it some thought, and just, look at it, as far as the fact that this is something that God created. They do have healing properties, and they really can be used to support the body.
Something else that's interesting. So, and again, like I'd like to use that explanation too about conventional medicine is using an EEG and EKG because we know we have these magnetic fields around the body. And we know that the body is actually electric. There's like legitimate, measurable electric activity within the heart. And then I think with crystals, because we do see the new age using crystals. So then as Christians, we're a little skeptical about it. But it's one thing to be using a crystal for divination. Or if I went and got a crystal and I was like, okay, crystal, tell me the future of what is going to happen today, or I'm worshiping the crystal or whatever. Like we know that that is like, as a Christian, that is a big no. But we also know that so crystals are actually like ultrasound machines also use specialized materials that are made from crystals. So like, are we like, so we have a health issue going on. Are we then going to be like, oh, no, we cannot get an ultrasound because those crystals in there are demonic? So again, like I do think that there's probably a lot we don't know about crystals and the frequencies that they may be giving off. But I think there's a good like differentiation between like, okay, God made this just like how God makes herbs, like we know that it's not that like we're worshiping herbal medicine or when we go out to get sunshine exposure. I'm not going and doing like a sun ritual and a little sun dance. I'm like, God created that. And I'm going to use the things that God has created to help to support the health of my body. So yeah, it's like really interesting stuff. Like I'm so excited about like all of these advances and we're learning about, the light therapy, the sound therapy, the frequency therapy, and I really do think how we're going to get around some of these hurdles, it is through education because I mean, we know there's always fear mongering about anything and everything. And so I also would love to hear a little bit about your experience going through the Functional Nurse Academy.
Sure. So I mean, the when I learned about the Functional Nurse Academy, I was just so impressed with the fact that this was, I mean, it really opened my eyes that this was something that could even be possible, that I could have my own business as a functional practitioner. I had no idea that as a nurse, I would have the ability to be connected, with the doctor to be able to order labs and then to be able to take those labs and really look at it, evaluate it, and then, find the patterns. And, we of course can't diagnose, but there's definitely things that we can look at to identify patterns and educate where there might be something that's out of balance and really take that investigative role and root cause. And so that was super exciting to me. And then as I was going through the program, just learning how important the foundations are. That was to see how everything in the body builds on one another. And when we can address one system, oftentimes it will affect all the others for the good. And so I'm really just so thankful for you because it really did open my eyes. From there, I proceeded to just take course after course after course. I'm so hungry for knowledge, and so I continue to do that. And now I'm actually going to school to be a naturopath.
Oh, that's amazing. I didn't know that. So how much longer do you have until you finish the program?
I'm in my second semester, and I have one more year.
Awesome. Awesome. And I know that you also mentioned that you have been free from the sick care model for how long now?
So I quit my job over a year and a half ago, but then I was still doing a little bit of per diem work. So I was still working here and there. But just in the last couple of months, I'm just completely free from it. So.
Oh, wonderful. And can you tell me how your training at Functional Nurse Academy helped you to break free from the sick care model?
Well, it really gave me the desire for one. Once your eyes are open, it's really hard to continue to be in that system. And then it really gave me the confidence and the ability. So in the Functional Nurse Academy, not only did we learn some of the principles and how to how the body works and how to interpret the labs and how to help our clients, but we also learned a lot of the business principles. And there was so much business support, sample contracts, sample questionnaires that we could use for our clients, and mentorship, and then also even referrals for attorneys and those kinds of things that we could use to help actually build our practice. So, definitely the Functional Nurse Academy, it gave me not only the desire and the knowledge, but the tools to really get my business established.
And it really is it's just like the best thing ever too. When when you're in the sick care system and it's so depressing because every time you see these people, they're worse. And then you're outside of the system and you actually have like your own freedom and flexibility and you see people get better. And it is like the best way to use the nursing license. But I also would like to hear about the services that you are offering. So I know that you have a new course out. Can you tell me about your course?
Sure. So my course is called Design to Thrive, and it really talks about getting your body ready for hormones. So it talks about um, the WHI study and some of the myths surrounding hormones. And then it talks about the different foundations of how you can support your body foundationally, everything from sleep to sunlight to nutrition. And then it gives a little brief overview of what how I would describe the physiologic hormone replacement therapy and why we would want to do that, of why we would want to follow the body's rhythms. So it's just a real introduction. And then from there, if you are curious and like it, then you could always go into my one-to-one membership, and that's where we really do a very individualized look at your labs, your goals, and what you're looking to do, or you can skip the course and go right into the membership. But most people would want to do the course and then go from there.
And so if they are in your wellness membership, then would they be able to have you run their labs? Like if they wanted like a GI map or blood testing?
Absolutely. Yeah, that's really what we go over. And within the membership, we we look at the lab results, but then there's also a lot of accountability and support and answering questions and the hormone education. So all of that is covered in the membership.
Oh, awesome. And I see that you're in California, but you have opened up services virtually in all 50 states, which I think is fantastic. And so I will be posting all of your links in the show notes. And I'll also put the link to your course if anybody wants to check that out. And if someone wants to work with you, where should they go?
So the best way is just to go to my website. It's holisticwellnessandcoaching.com. And that will have the link for the different pages. There will be a link for the course as well as the membership. And then I think you'll have the link in the show notes too. But if you're interested about the sound therapy, there's a link there for just a free session with that. And so in order to access that, you can go to innervoice.holisticwellnessandcoaching.com. And then you can see for yourself what sound therapy session would be like.
Amazing. So, yes, I'm going to post all of that in the show notes for our audience. So, be sure to check that out, guys. Again, it's holisticwellnessandcoaching.com. And I am just so excited about like training more and more and more nurses because I mean, we're having a big impact in the holistic space. Like there's so much we can do to help people. And I feel like we've seen the dark side of medicine, but we've also seen where medicine can thrive. So like when you're working with an experienced nurse, we tend to not be like completely anti-medicine and we know how to collaborate and advocate. So, well, thank you for coming on the show, Michele.
Thank you so much. I really appreciate it. It was great
Yes,
talking with
this
you
was
again.
fun. These shows always go by so quick. That is all the time that we have today. If you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.